Cold hands, warm drinks, and delicious sweet foods. Yes, the winters have arrived. But for the kidney patient, this season can be called as an alert period as it brings its own set of challenges for the patient's health. Hello everyone, my name is Dr. Puru Dhawan and in today's video, we will explore how the winter season impact the kidney patients and share steps to manage these challenges effectively. So let's begin the today's video. First comes the muscle contraction. Muscle contraction can be a thing to worry about for a kidney patient. Let's see how. As the patient feels cold in the winters, they shiver a lot and their muscles starts contracting. This is not normal for a healthy person, but for a kidney patient, it is not. Actually, the muscles are the factory for the creatinine production. So when they contract, the creatinine production start increasing. Now, its removal is taking place at a low speed, but the production has increased. So this will boost up the creatinine level in the patient's blood, and this will further create more problems. But remember that you need not to panic in this situation, as it has nothing to do with your kidneys. It's just a result of your body trying to stay warm. However, to prevent this, the solution is simple. Stay warm. Wear woolen clothes and keep your room cozy with the heater if possible. You can say that staying warm not only helps the patient to feel comfortable, but also reduces the stress on the patient's kidney. Now next comes the liquid intake. In winters, many of us switch to the hot beverages like tea and coffee to stay warm. While these beverages are loved by almost everyone, kidney patients need to stay cautious regarding their consumption. Why? Because both tea and coffee contains a chemical called tannin, which interferes with the iron absorption in the patient's body. The patient eat iron-rich food, but they don't get absorbed in the body. On the top of all this, anemia, the blood deficiency disease, is also commonly found in patients due to the less production of the erythropoietin. To compensate this deficiency, the patient takes erythropoietin injection. But all of this go to the waste if the tea and the coffee are in the list of the patient daily intake. As a result, the patient might become too much weak. So to prevent this situation, avoid these drinks. As an alternative, you can go for herbal drinks like fennel, cardamom or fenugreek seed water. These are kidney-friendly drinks which will not only provide warmth to the body but also good for the digestive health. I hope this much is clear to you. After the food intake, the next comes the food choices for the winter. Winter brings along many mouth-watering sweet dishes made up of jaggery and filled with many dry foods like raisins and dates. Talking about jaggery, it is considered as a power-packed sweet snack which along with the purifying the blood, it is beneficial for the whole body. But for a kidney patient, jaggery is harmful due to its high potassium content. High potassium can cause serious issues in the body, among which the major one is the cardiac arrest. And also, it might shoot up the blood glucose level, which is again a worrying situation for the patient. So avoid all food item made from jaggery. If you crave for any sweet dish, then you may add double refined sulfurless sugar in your food. Next comes the canned soups. These tasty soups are highly consumed in winter as these canned soups contain a lot of preservative and are high in added salt, which can increase the patient's sodium levels. And this can further lead to a swelling issues. So avoid the jaggery, sweet dishes and the hot canned soups. Lastly, dressing completely is very important. For kidney patient, clothing is not just about fashion or comfort. It is critical part of staying healthy during the winter season. So the patient should try to keep the body warm and protected. And for this, padded jacket is a great use. It is a special type of jacket which keeps the body warm and protected from the extreme cold climate. Additionally, patients should also wear gloves, woolen cap and thermal innerwear. These essentials not only provide comfort but also maintain body temperature, reducing the strain on the kidney and improving blood circulation. Dress smart and try to keep your body as warm as possible. So this was all in today's video. I hope you have understood each and every point clearly. Winter can be challenging for kidney patients, but with the right precautions, the patient can protect their health and enjoy the season safely. Remember, your kidneys work tirelessly for you every day, so give them the care they deserve. I will see you in the next video with more such information content. Till then, take care, bye bye, and namaste.